Professor David Sweanor is about to join us. And, there's been a lot about vaping and tobacco. And, it's funny. We had a pretty good discussion of this a couple of months ago. And it was actually a store operator who had one of those discount tobacco outlets. And he was a pretty firm believer that vaping was, from his experience, converting his tobacco smoking cigarette people into non-smokers. They were vaping their way out of their tobacco addiction. And this is very controversial now about whether or not this is possible. Our guest, Professor David Sweanor, he is an expert in this area for sure. He chairs the advisory committee of the Center for Health Law, Policy, and Ethics at the University of Ottawa. He's helped spearhead the development of tobacco control initiatives in Canada since the early 1980s. First as counsel to the Non-Smokers' Rights Association, then as an independent counsel. He's also assisted the World Bank and the World Health Organization on this big, controversial, powerful healthcare and well-being issue. Professor, it's a real pleasure to have you on the show today. Thank you for joining us.
Well, great to have you again.
The rights of, this is interesting that you were an early advocate, the rights of non-smokers. What is the overall big progress? It seems like there's a big drop in tobacco consumption in North America. And from my personal observation, being in the Northeast a lot, having gone up to the Montreal area, all the way back down to Florida, I feel it, but what's the real data tell us?
Sure. Well, we've seen a very significant drop, and more so among young people than adults, but right across the overall population, a huge drop, but within subgroups of the population, not nearly as much. So we're dealing with a lot of marginalized populations, people with mental health issues, a lot of people who are, just diehard smokers, a lot of people who get some sort of benefit from nicotine, and if the only way they can get it is smoking cigarettes, that's what they'll do. So we've seen progress, but we're still in a situation where globally, about 20,000 people a day die as a direct result of smoking cigarettes. And we know it's the smoke. It isn't the nicotine. It's the inhalation of smoke that's killing people. So we've known for a very long time that if we could simply move people to getting their nicotine without inhaling smoke into their lungs, we could largely solve the issue. And now we have science and technology essentially doing that, which is now creating a huge controversy between those who believe that our goal here is to reduce death and disease, meet consumer needs, be pragmatic, and those who see this more as a moralist, abstinence only, nobody should use any nicotine in any sort of way sort of approach. And it's got pretty vicious, not unlike we've seen on many other health issues over time.